it's a pleasure to be with you. And as you say, I'm here actually in Bethesda, Maryland, which is just outside Washington, D.C. And you can see the sun is coming up finally in the background, and it'll get lighter. I'm very happy to talk to the group and everyone here about what we're doing and what we've tried to do, helping some partners in Brazil and in the East African community. Also like to say it's a pleasure to be here with Klaus and Martin as well. And I'm a little envious of Martin, who clearly is in a very nice place in the Black Forest. So I hope that goes well. And I think we're going to throw up my slides. Yeah, perfect. And I apologize for doing slides. I typically like to avoid them, but here we are. There's a lot of information to present. So if we could pop to the next slide. So Place Fund itself, we started in January of this year. And of course, we could never have anticipated that we would start a new venture and COVID would come. So it's been very busy times for us. We come from the Omidyar network, and the Omidyar network was formed by Pierre and Pam Omidyar about 14 years ago. Pierre Omidyar is the founder and currently the chairman of eBay. And much like Bill Gates decided that once eBay went public in the late 90s, that he would dedicate much of his fortune to positive social impact. And so he created an impact investing firm or philanthropic investing firm to work on 6 key areas that he felt he could make a difference in. And I joined in about 2012, 2013, where I led one of the global initiatives for investments around property rights. How do we help people, particularly in emerging economies, gain security around the place that they work and live? And I spent 7 years doing a mix of both for-profit investments and non-profit grants, which was very much the design idea of Pierre, which was to also be able to invest in companies that were having positive social impact, as well as give grants. The idea being that if you can invest in a business that could be successful, it would be sustainable and be able to get to scale with positive social impact, and one would not have to continue to provide grants to a non-profit. But we provided a range of grants for pure research all the way to investments in more commercial entities. And we did that for about 8 years. And then in January of this year, we took that property rights initiative that we had developed and all of our partner portfolio organizations, and we spun it off into a new nonprofit organization called the Place Fund. And I can talk a little bit more about what we're intending to do here and how we've come to help these organizations. But if we could move on to the next slide, please. So we built Place Fund, and this very much comes from the values at Omidyar Network. These were sort of the core principles of what we felt we needed to build around. First and foremost is this notion of trust. And we see it even more now with COVID. Who do I trust? What do I trust? What information, what data do I trust? What partners, what people do I trust? Trust has become essential because there are many forces that are looking to erode trust. And so we put trust as one of our core principles. We want to fill the gap for failed public goods. One of the things that we understood at Omidyar Network was that you could have market-based solutions that could fill failed public goods and the delivery of failed public goods. And unfortunately, in many emerging economies, public institutions struggle for various reasons to provide that public good service, whether it be healthcare or education or power, water and sewer, property rights, they struggle. So a focus on how do we fill the void created by failed public goods. Sustainability, we very much, and my background is in private business. I've run several software companies, the last one of which I sold to Thomson Reuters before joining Omidyar. So my perspective is always, how do we create something that is sustainable and doesn't rely on a continued inflow of grants? How do we develop a model that very much partners and works at the local level? So this concept of being decentralized, but providing only those things that local organizations themselves can't, which is access to resources, networks, capital, and the ability to scale. A key focus is technology. How do we deploy technology to get scale and sustainability? How do we keep our team small but highly, very deep in expertise? And how do we constantly look to drive change? Very much based on open data, open access concepts. So we want to be transparent in the way that we work and the way that we share information, yet at the same time, very much have a focus on security and privacy. And as you'll hear a little later, we take very seriously ethical design principles in all of the work that we do. Thank you. For next slide, please. So one of the things, and I will admit fully that I am a very proud geographer by training. I'm not a health expert. So of course I have loved maps ever since I could probably walk, to be honest with you, and have worked with electronic digital mapping, geographic information systems or GIS, remote sensing, Earth observation satellites for a very long time. It's interwoven to the work that we do at the Place Fund. And so we have become early adopters and users of this dashboard, probably of which the most famous is the Johns Hopkins University here in Maryland, which was the first to stand up this sort of easy to understand and easy to use dashboard on reporting COVID, confirmed cases, deaths, etc. And that was very much at the center of one of the applications that we're going to show you, which is for Rio de Janeiro. We were contacted by a former partner of ours, Catalytic Communities, which has been working in the favelas in Rio for the last 20 plus years. And this is really important because the only way that you can work effectively in the favela, which is the informal settlements, so these are places that are not officially recognized by government, and they're in many ways self-organized. They're considered in many instances illegal. And as we saw in the run to the Olympics and the World Cup in Brazil, there was a lot of conflict around wanting to evict the favela dwellers. Now, there are approximately 1.5 to 1.6 million people living in favelas in Rio, in more than 45 local communities and settlements. And Catalytic Communities has been working for 20 years with all of the organizations in the different favelas. And you remember that one of our first design principles was trust. Well, there is no way that you can work in the favelas if you don't have the trust of the community, and that you don't have trusted partners to help you work in those communities. And this is what Catalytic Communities has done. Next slide, please. So they came to us and they said, the problem we have to solve is that the government of Brazil is not reporting what is going on in the favelas. And it's a huge issue, it's a huge public health issue, and they're refusing to report any of the data, not just for us, but in general. And we need a way to self-report what is going on in the communities. And so one of our key partners is the Commons Project, which, like us, is a nonprofit organization which believes in empowering individuals to maintain and keep their own health data. And they had developed a self-reporting app called COVID Check. And what we suggested is that the first thing that we work with on catalytic communities and their local representatives in the favelas was a simple way to have the community self-report their own symptoms. So we open sourced the logic behind COVID Check, which actually is a responsive web app which can run on any mobile device. We didn't have the time to go through certifying as an actual app on iOS or Android. So we used a simple responsive web app that was a very simple, easy to follow questionnaire that walked you through structured questions to gain an idea of whether or not you might be at low, medium, or high risk of exposure to COVID. Now, the data, of course, is not perfect from an epidemiological standpoint, but when you have nothing and when you have no official data, the idea is that this is much better than nothing. And we tried to use a structured epidemiological process, and the Commons Project is full of ex-CDC specialists from the US and other medical professionals who help structure the logic. We also had to move into Portuguese very quickly, and not just Portuguese, but the language was worked on very carefully with the local communities, because you wanted, you have different levels of literacy, and the way that you actually write something becomes so important because people can get confused or misunderstand. And so it's so important, the phrasing and wording that you use. And there were multiple iterations through agile process, daily process, of tuning the language and to make sure that we reduced as much as possible any confusion. The app was, the responsive link was made available to anybody and everyone. All of the data is stored on a local device. And then the results are sent to a central server that generates a report. The report is sent back as HTML to the device. So no data is stored centrally. And then the statistical data is sent to the mapping dashboard, which is the second piece of the puzzle, if you will, which is the aggregator, the dashboard, which says, how bad is the problem? And here you see an example, and this is a live website. They're actually doing a press conference today in Brazil. It's favelas.info. You can go there and access it. It's now up and running and maintained by catalytic communities themselves. And they are changing the interface every week to tune for feedback. And they now have a very sophisticated dashboard that was developed in approximately 4 weeks with them. One of the issues that we had is that the favelas are defined by boundaries that are not official. And so in order to report statistics by a favela, you have to first define the favela. And it's actually a very hard problem because, of course, they're not officially recognized. So there is no official definition of the boundary of a favela. And so one of the first things we actually had to do is go to all of the different community organizations and aggregate their boundary maps that they had and make it into a common digital layer. So one of the first outputs of the mapping dashboard is actually, for the first time, a common up-to-date geographic representation of where the favelas are, the names the community gives them, and the boundaries. So we can now report statistics by the favelas, because the official statistics, if they exist, are reported by the equivalent of postal code areas, which are much, much larger and include very high income neighborhoods, which greatly distort. If you're not reporting favelas and you're only reporting the high income areas of the zip code or the postal code, then the data skews very much towards low prevalence of COVID. And it doesn't give you the story of what's really happening within that larger administrative area. So this favela definition became key. So this is up now and running. And as I say, the Catalytic Communities, which is a nonprofit, is now maintaining this. We also partnered with ESRI, a commercial GIS mapping software company, And that was one of the reasons we were quickly able to iterate a design interface and put it into Portuguese with the community. The code of the application on top of ESRI's website is open and available for anyone else to clone and use themselves. And there is no IP claim by us on either the logic of the self-reporter or the mapping dashboard. There is no interest for us to hold that IP. Thank you. Next slide, please. So the second dashboard was slightly different, using a different technology and very much a different client, which in this case is the official East African community, which is 6 countries in East Africa. It's an economic community with growing influence. It's Burundi, Rwanda, South Sudan, Uganda, Tanzania, and Kenya. And they had come to us and asked us for a way to represent very early on the growing trends of COVID cases in those 6 countries. Particularly countries like Burundi and South Sudan were struggling to have the presentation of the official statistics that were coming from the ministries of health. And so in this case, we worked with the technology team at the East African community to quickly design a web mapping dashboard. This is completely open source. All of the code is on GitHub. The website is covidcheck.eac.int as this representation. And here we again used Agile and Scrum development to create a dashboard with the information that the government officials wanted to present in the way they wanted to present. And you can see that the design interface is very simple and very clean because of the way that the governments wanted the information to work. If we could flick to the next slide. We had to be able to quickly aggregate and build different data feeds. So we started pulling the Johns Hopkins data feeds on a live basis. We had to do some data manipulation to get it in a way that the governments wanted and would agree. And we started pulling mobility data from the Google, in particular Google and now Apple, and had to do some data work to show that, because governments wanted to see how were their lockdowns having an effect on movement of people? What was their lockdown being effective? And even from the grosser data coming from those Google and Apple would give you a very good indication of a larger population trends of movement for different purposes. And we also then started pulling data feeds from WHO on health facilities and population data from the World Pop database, both publicly available databases, but streaming them and putting them in so that you could do simple visual analysis of where were the health facilities in each country, what were the capabilities of the health facilities, and where were the outbreaks occurring in different districts, and so what was the likelihood and ability to respond. And we then started linking to, again, the symptom checker, which is being used, and being able to provide charts to show changes over time. And the chart here that you see in the bottom right is the upward curve there is actually Kenya. And the one that hasn't changed is Tanzania. And I would leave you to draw your own conclusions about what those data sets represent in terms of the official data of COVID in these countries. So a very different process, a very different client base, but again, partnerships were key, trust was key. The dashboard here and all the data wrangling was stood up in 4 weeks, working with the East Africa community. There was a lot of back-end data processing that had to work to make this simple dashboard come to life. And we now continue to maintain it for, excuse me, for the East African community. But we hope that they will, once things calm down a little bit, that of course they have access to all of the source code, and that they'll be able to make the changes that they would like to see going forward. So I think that's it for my presentation. Just check for the next slide, and that will confirm it. But I think that's it for me. So Uli, very happy to take questions at this point or in the panel discussion, but thank you all very much for listening.